Okay, let's talk about gout. And this is part 2 of the musculoskeletal system video. If you have not watched my first video about musculoskeletal system part 1, please watch that one first and then watch this one. Let's talk about gout. Basically, what happens with gout? Gout is a pain increased at night due to drinking less fluids, or if you're dehydrated at any time of the day, it's gonna be bad. They get very sensitive to pain, where if it touches the sheets, it's painful. Usually they tend to have the uric acid is above or greater than 6 milligram per dl. The normal level is less than 6 milligram per dl. Um, what are triggers of an acute gout attack? Alcohol, alcohol, alcohol. Let me tell you about the list of the 3 risk factors first. African American men, excessive alcohol intake, and chronic kidney disease and obesity. These are the risk factors for gout. Triggers, like I was saying, alcohol, trauma, surgery, infections, or high purine diet. They want to stay away from that. 3 medications or more for treatment, or what would they take? That will be the allopurinol. For example, if you see allopurinol, the word, in your pharmacology exam, in your any exam, and you don't know what, you don't know what does that mean, what does that do, what's going on, right? So you see allo, and then you see pure renal, right? And remember, high purine diet triggers what? Gout. So allopurinol is one of the treatments. Cocaine, NSAIDs, steroids, and propenicid, which is going to help increase exertion of uric acid out of your body. 5 types of foods that are high in purine diet. That would be red meats, alcohol, high fructose drinks, wine, and shellfish. What's the main symptoms of acute phase? Pain, like pain, very bad pain, chronic gouts, get beat toffee. Education, you want to limit the alcohol, you want to do weight reduction, you want to do diet, you want to increase your fluids, you want to make sure you're not dehydrated. If you already have like a chronic kidney disease, or if you already have, for example, the triggers I was talking about, obesity, excessive, you take a lot of excessive alcohol intake, you want to make sure, be mindful of gout and what might happen of gout, and how can you get it. Education, you always want to educate your patients, like I said, and this is it about gout. This is the most important information that you need to know. Fibromyalgia. We have 3 common symptoms of fibromyalgia, right? Pain, pain, pain. Pain is going to be one of your main symptoms for all your musculoskeletal system diseases or diagnoses. 1 is pain. They're going to be tired, fatigue, insomnia. And remember, anytime we have pain as a symptom, you need to remember that along with the pain, you get depression, tired, you get fatigued, okay? They get insomnia, they get stiffness, they can't take any opioids, psychosocial, like I said, depression, migraine headaches, restlessness. And then if you already have pain, you're fatigued, you're depression, so imagine how can that affect your patient's life, right? So you need to educate your patient about all of these and the risk factors, and how can you prevent this, and all the interventions that they can do. For example, some non-pharmacological interventions, therapies that they can do is massages, heat or cold therapy, rest or relaxation techniques, and of course therapy, counseling, and support groups. Pharm therapies, that is going to be NSAIDs, muscle relaxants, and benzodiazepines. Okay, diagnostics, you're gonna use pain. Usually, they tell you that when the pain lasts more than 3 months within their joints, it's fibromyalgia. But to confirm, they will go ahead and do a muscle biopsy um, just to make sure if it is fibromyalgia and test it. Teaching, of course, no sugar, caffeine, or alcohol. No, 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 no. And of course, you will need vitamins and for the fatigue. Bone cancer. Bone cancer. Bone cancer. What's the manifestations for bone cancer? You're gonna have pain. Like I said, pain is it's always gonna be there in all your musculoskeletal system diseases. Their bone breaks and fractures easily. It's super easy. They do CT scan, biopsy, PET scan, MRI, and calcium, high levels of calcium. All of these are just diagnostic studies that they do to check if you have a bone cancer. What medications to treat pain? Chemotherapy to shrink the tumor, radiation, pain management, and palliative care. I would say bone cancer is really hard because I worked in cancer and I know how it is. Chemotherapy really affects the patient, so you need to be mindful of your patient. And on like chemotherapy, your patient might be like depressed. Some of them are full of life and they fight for the cancer, but you need to be mindful and you need to keep your patient, and you need to learn how your patient copes with the cancer. Once you learn how the patient copes with the cancer, then after that you can actually try and help the patient in a way that you have figured out on how to make the patient happy. Um, as I said, radiation, pain management, and palliative care. 3 complications: fractures, decreased mobility, and anemia. Okay. Also, there is a really important complication that's not listed there, and that would be DVTs. If your patient easily breaks, if the patient easily fractured bones, you need to be mindful that if your patient has a broken bone, that means they're not active as much, that means they're not walking as much or ambulating, or they might be on bed rest and they cannot do that by orders of the doctor. So you need to make sure that you have Flavonox or any anticoagulant agent ordered for your patient, so to prevent any DVTs and any clots, because if the patient gets a clot and they have a bone cancer, it's a really big deal. Amputation. Amputation can be below the knee amputation, which is BKA, or AKA, which is above the knee amputation. What are possible causes? Diabetes. We tend to see a lot of diabetic patients, chronic diabetic patients, that their diabetes is not controlled, to have they end with an amputation because all the sugar. Osteomyelitis, like I said earlier in part 1, amputation is part of the complication of osteomyelitis. Vascular diseases, of course, like I said, cancer, massive infections, trauma, accident, burn, all of these can cause amputation. Accidents and burn and trauma, since I worked in trauma, I have seen amputations before. It was by trauma or an accident that happened. Massive infections. If you think about massive infections and amputation, it's a really broad. Like range of diseases that you might have. How you ended up with a massive infection, and you really need to think about how can you prevent an infection. okay? You always want to prevent an infection. And once you see an infection, or you see symptoms of the infection, or you see, even just a little redness around the surgical side, around anywhere in the body, on the skin, you will need to make sure and you report it so that it can get checked out, because infection, it's not, if you're already immunosuppressed and you get an infection, it's a really big deal. It might not be a big deal for a healthy person. They can take antibiotics and it's gone, okay, wherever. But you will need to make sure you educate your patient about infection, how you prevent it, all the time. Okay, so you have closed or open amputation. Okay, let's talk about these. If you have a closed amputation, basically it's closed. You know what I mean? Like, it will look like this. You see here? So it will look like this, like flat. Okay. Basically, when it creates a weight-bearing residual stump, which is along the suture line. You will see patients that they have done an amputation, or they got one of their legs, one of their arms amputated. You're gonna see a stump at the end. You will see like the stump right here, or in the knee, or if it's below the knee, above the knee, whatever the amputation happened or took place, you're gonna see a stump. For prosthesis sometimes as well, if you're overall healthy and the weights, you want to make sure you elevate the limb, and prone, you want to, sleep or lay down prone. Of course, you're going to work with physical therapy and occupational therapy. And for those who doesn't know what prone means, which is the opposite of supine. Supine is when you lay in your back. Prone is when you lay in your stomach. Open is basically a portion of the flap left open. And that is a very risk of infection. If you leave a flap, you're always going to have a risk of infection. So when we talk about flap, let's talk about flap a little bit. Do you know what flap is? Basically, a flap is like how I said, it's closed earlier, right? And you put a stump, that's a closed amputation. Open amputation, it's a flap, which is like with your own skin, where you need to touch it and it's gonna be blanchable. Okay? You're gonna do a Q4 neuro checks to the site, pulses, and everything. Okay, you're gonna do a full neuro check Q4 hour, and you wanna test your site where it got amputated and needs to be blanchable. Okay. You have complications of amputation. There's gonna be infection, self-care issues, depression, bleeding, and phantom pain. Phantom pain comes from amputation. So anybody that has an amputation, they're gonna have a phantom pain, where your transmitters is gonna send pain signals to the leg, thinking the leg is still there, right? And then the nerves are just gonna hit and like sparkle, and that's where the pain happens. How do you prevent a flexion contracture? Prone with the hip extended, like I said. Avoid sitting in a chair for more than 1 hour, and no pillow under extremity. Compression really helps decrease the pain, swelling, can help healing. Psych is really important. Let's see, muscle dystrophies. That one, it's okay. You don't really need to know about it. 3 diagnosis tests. You're gonna do CK, muscle fiber biopsy, EMG. It's right there if you need to look at it or write it down for your information, but they tend not to ask really about this. 3 risks important are falls, aspiration, and deformities. I hope this was helpful to all of y'all. If you have any questions, just let me know or drop it down on the comments, and I will answer all your questions. Thank you so much for watching, and watch out for an upcoming video. Thank you.